His hands were shaking more than mine, which, considering I was the one holding the needle, was saying something about the night. I was on the third night of my residency, the hallway lights humming low like a distant choir, the scent of disinfectant and stale coffee hanging in the air. The emergency department was a place where time stretched and compressed at the same time, where the beep of a monitor could feel like a heartbeat you were trying to keep in rhythm with your own. I'd just finished stitching a laceration on the teenager who'd tried to impress his friends with a skateboard trick gone wrong, and the next patient was already being wheeled in. He was a lanky guy in his late 20s, his eyes darting between the ceiling tiles and my face, as if trying to decide whether I was an enemy or a savior. He clutched a thin blanket around his shoulders, his skin pale, the veins in his forearm barely visible beneath the thin fabric of his shirt. He'd been in a minor car accident, nothing that would break bones, but enough to leave him with a throbbing arm and a tremor that made his whole body feel like a leaf in a windstorm. "Hey," I said, letting my voice settle into the low hum of the room. "I'm Maya. I'm going to help you feel a little better, okay?" He nodded, a tiny flicker of relief in his eyes. I could see his breath fogging on the cheap plastic of the IV stand, a reminder that his body was still trying to fight off the shock. The nurse beside me set up the IV line, the translucent tubing glinting in the fluorescent light. I could hear the soft rustle of the latex gloves as I slipped one on, the rubber cool against my fingertips. The smell of the antiseptic swab was sharp, a clean, almost metallic scent that somehow made the room feel more intimate, like a secret we were sharing. I asked him to roll up his sleeve and sit on the edge of the stretcher, a small task that felt like an invitation to trust. He obeyed, his fingers trembling as they unfolded the fabric. I took a moment to glance at his arm, feeling the subtle rise and fall of his pulse under my palm. The muscle was firm enough. A little tension in the deltoid, a good spot for an intramuscular injection. "Do you remember how we do these shots?" I asked, trying to keep my tone light, a little teasing. "You're going to help me find the perfect spot, and I promise I won't make it feel like a fireworks show." He managed a weak laugh, the sound barely making it past the hum of the monitors. "I'm not sure," he admitted, his voice a whisper that seemed to echo in the sterile hallway. I smiled, feeling the gentle weight of his trust. "Okay, we'll make it a team effort. First, I'll locate the deltoid. It's that muscle you feel just below the shoulder, the one that's kind of like a cushion for the needle. You can find it by feeling for the top of the shoulder and moving your hand down a little, about a finger's width. That's where the muscle thickens." He followed my guidance, his hand moving over his own arm, his fingers searching for the bony ridge of the acromion, then sliding down until he felt the soft mound of muscle. I watched his eyes narrow in concentration, the way his brow furrowed as he tried to understand the map inside his own body. It was a strange, almost tender moment, seeing someone else navigate the terrain of their own anatomy with my words as a compass. "Got it?" I asked, my voice barely above a whisper. He nodded, his hand now resting gently on the spot I'd indicated. I could feel the faint tremor in his fingers, a silent rhythm that matched the steady beat of the heart monitor. I pulled the syringe from the tray, the clear barrel catching the light, the needle glinting like a tiny silver thread. I checked the dosage, making sure the medication was ready. A single dose of tetanus toxoid, the standard prophylaxis after any puncture wound or bruise that could have been contaminated. I reminded him of the importance of the injection, just as a gentle reminder of a secret between us. The tetanus shot is a little like a shield. It helps your body recognize the bacteria that caused tetanus, so it can fight it off before it gets a chance to cause trouble. We give it in the muscle because it's absorbed faster that way, and it gives your immune system a clear signal. He swallowed, his throat dry, and I could see the flicker of curiosity in his eyes. So it's like a warning system? Exactly, I said, smiling. Your body gets the memo, and it's ready to act if it ever runs into that nasty bug. I swabbed the skin with an alcohol pad, the cool wetness spreading across the surface, a brief chill that made his skin prickle. The scent of the alcohol was sharp, almost like a promise of cleanliness. I let the pad dry, the tiny hiss of evaporating liquid filling the quiet. Now came the moment that always feels like a ritual. I held the syringe like a small wand, the barrel steady in my hand, the needle angled at about a 90-degree angle to the skin, straight in, no tilt. I reminded myself to keep the needle in the center of the muscle, avoiding the nerves that run along the side. I told him, I'm going to insert the needle quickly, but gently. The muscle will relax if you breathe out slowly as I do it. He inhaled, his chest rising, and exhaled, a slow sigh that seemed to release a little of the tension. I pressed the needle into the skin, feeling the first resistance as the tip pierced the surface, then the deeper give of the muscle as it slipped in. The sensation was brief, a sharp pinch that lasted no longer than a heartbeat. I could see his eyes widen for a moment, then soften as I injected the medication, the plunger moving smoothly, the liquid flowing into his deltoid. Almost done, I whispered, watching the tiny bubbles of air rise up the barrel and disappear. You're doing great. When the syringe was empty, I withdrew the needle, a small, clean motion, and placed a cotton ball over the site. I pressed gently, feeling the warmth of his skin through the gauze, a subtle heat that reminded me that beneath the clinical routine, there was always a living, breathing person. The cotton was left in place, a soft barrier against the world. I wrapped the IV line, the clear tubing now filled with a steady drip of saline, the rhythm of the infusion a quiet metronome in the background. I turned to him, my voice softening. You're all set for the tetanus. It'll take a couple of weeks for your body to build full protection, so we'll give you a booster in about a year, just to keep the shield strong. He smiled, a shy, grateful curve of his lips that made his cheeks flush a little pink. Thank you, he said, his voice steadier now. I was scared of the needle, but you made it feel okay. I laughed, a gentle sound that seemed to settle the room. I'm glad I could be your guide. And remember, if you ever get a fever, anything above 132 degrees Fahrenheit, stay hydrated, rest, and use acetaminophen or ibuprofen as needed. If it spikes higher or you notice a rash, give us a call. We'll make sure it's nothing serious. He nodded, his eyes now bright with a mix of relief and curiosity. I'll keep that in mind, and if I ever need another shot, I'll remember how to find the muscle. I felt a quiet satisfaction settle in my chest, a warm glow that had nothing to do with the fluorescent lights. The night was still young, the hallway still humming, but for a moment, I had been more than a nurse. I had been a confidant, a calm presence in a storm of anxiety. I slipped the gloves off, feeling the slight resistance of the latex, and placed them in the bin with a soft thud. He stood, his arm now a little lighter, the cotton ball still pressed against his skin. He gave me a lingering glance, a beat longer than needed, as if thanking me for more than the medicine. I returned the smile, a small private acknowledgement of the trust we'd shared. Take care, I said, the words slipping out like a promise. And if you ever need a friendly voice, you know where to find me. He turned and walked toward the door, the soft shuffle of his shoes echoing down the corridor. I watched him disappear, the night air outside pressing against the window, and felt the quiet pleasure of a moment that had been both clinical and intimate, a reminder that even in the sterile world of medicine, there's always room for a gentle touch.